Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. Our show is dedicated, as you know, to the prevention and safe and effective way of treating all forms of medical problems. I want to first get right to thank my sponsors, promolife.com, promolife.com. Promolife makes amazing ozone products. They make home care generators so that you can do ozone home care on yourself. Can make ozonated water, all the different insufflations. We've done a show on ozone home care. You ought to listen to it and realize that how important this can be. They also make amazing ozonated products, various, since we're dealing with dentistry today, oil pulling products, organic ozonated oil pulling products, organic ozonated oils that you can brush into your teeth. And now the latest and possibly going to be the bestest, the organic ozonated glycerin. Very powerful at treating infections and preventing infections and preventing and dealing with dental issues. You could reach them at promolife.com, promolife.com, or at 888-742-3404. I tell you to call them because if you say you heard about them here on the show, they'll give you something off. The price is some percentage off or some special gift depending on what you're buying. So call them at 888-742-3404. Say you heard about it here on Dr. Howard's show, and they'll do something for you. Then my second sponsor is doctorsbiome.com. doctorsbiome.com. You can only deal with them online. And why should you? They make a very special probiotic beverage. First of all, it's delicious. One of them, called Doctor's Biome Gut Health, comes in a 100% organic mint, kale, lettuce, celery, cucumber, apple juice. So it's delicious to drink. But at the same time, it has no fermentation, no alcohol, no sugars of consequence. Everything is ideal for diabetics, you name it. And why do you need it? Because every day we destroy the healthy bacteria in our gut with the food we eat and whatever we drink, because it's all contaminated. No such thing as sterile food. So you have to have a healthy gut because the gut connects to everything. And in fact, as you'll learn, the mouth connects to everything in your body. And if you don't have a healthy mouth, you can't have a healthy gut. And you can't have a healthy gut if you don't have a healthy mouth. It's called the gut-mouth axis. Dozens of papers written on it. So go there, and because it's not an inexpensive product that is created to survive the stomach over 90% and stick to the wall of your gut, where capsule, powder, and tablet forms of probiotics are destroyed over 90% in the stomach and not able to stick necessarily to the wall of the gut unless they did grow into healthy adults that are physically structured to do so. So when you go there, you can use my patient coupon code, Howard35. And with Howard35, you'll get 10% off the retail price, which you'll see is a very nice savings. And if you go on auto ship, you can actually get an additional 10% off. Many doctors and dentists are selling this now all over the world, literally, and they've realized how important probiotics are in dentistry. Now we're going to get right to our show. This is a part two, okay, with Dr. Greg Vigoren, who practices for 50 years now in Newport Beach out of his 55 years as a dentist. And let's just go right to the show. Normally I used to give big build-ups on all the lectures that a doctor has given and all the places he's spoken and all his. I find now I don't think people are as interested in as what you have to say. So good morning again, Dr. Vigoren.
Good morning. Good morning, Howard.
Let's get right to the show.
Okay, well, to get right into it, I talked about in previous shows about the importance and the disruption of sleep fragmentation cycles. In other words, your regenerative sleep. Everybody talks about sleep, but nobody tells you how to get good sleep. And then the last one, I talked about the holes and the cracks in teeth and how you can prevent those from being a dental issue the rest of your life, and how you can educate people to be much cleaner, and eliminate those two things: education and uh, doing obliterating the holes in the cracks. You can eliminate 90%, 98% of all future dental disease. Today, what I want to talk about is a defect in our educational system. And I wasn't a genius when I started dental school, but I didn't like one of the things they told us that we should do, which was to leave debris in the preparation. The preparation and how you prepared it was the gold standard, and you didn't want to go too deep, and so you actually left what they called stain in the tooth. Well, it wasn't stain; it was active bacterial disease, and if the instructors generationally have believed that if you take that all out, you're going to have to do more root canals and you'll have more sensitivity and the patient will be madder at you. They do that on their own families. But the problem is you've just covered up the disease process. And it doesn't, the theory was once you cover it up, it dies, but it doesn't. And so the process of destroying the teeth by these organisms continues. And so what am I basing this on? Well, when I was in dental school, I actually got graded down by one instructor for taking out the discoloration in the inside of the tooth. And so for the rest of my career, I did it the way they wanted. And then as soon as they were done grading me and they walked away, I took it all out. Well, it just so happened that all those first patients were family and relatives, and friends, family and friends. And I still see two of those, my two brothers, 55 years later, and almost all of my patients and my relatives lived the rest of their life without having to redo any work that I did. Now, when I did that, I didn't know that I was doing something that was that significant and that different from the norm. So now, 55 years later, we routinely use high magnification, both with surgical loupes and with high resolution cameras and high resolution displays. And we can actually show the patients what we do that's different, explain why we do it, and and get multiples, 4 to 10 times longer success rates, durability, predictability, and therefore lower dental costs, because the value of dentistry is not just the price, it's the cost of doing the procedure divided by the number of years that it lasts. And on average now, most dentistry, and this is from billions of insurance claims, they know the date that a procedure was done. Take it, for instance, a crown, and when that crown gets put in to be redone because of decay or some failure. And it just so happens that's 3.7 years. Well, I have work that's been in the mouth for 55 years in large quantities.
Mhm.
And so attention to the bacteria inside of the tooth and how you handle that is paramount on the durability of the restorative dentistry of repairing the tooth. And so it's when we look at teeth that have fillings or that have root canals. And by the way, everything you've ever heard about root canals that's bad is absolutely true if you insert three caveats. One is poorly done. You didn't get to the end of the tooth. You didn't clean out all the stuff. You didn't fill it to the end. That you went through bacterial contamination. In other words, you did a sterile root canal through a sewer hole, okay, or that the restoration, the crown or the final procedure that you did to build the tooth up after you did the root canal is leaking. And if any of those things are true, you have a bad root canal 90 to 120 days later, and an infection that you'll have for the rest of your life. Well, you can retreat those under sterile conditions, do a good job, and seal them. And I've done over. And by the way, I hate doing root canals. It's the least. Uh, it's a procedure I enjoy the least out of everything I do. But I've probably done 12,000 root canals, and of those, 10,000 have been retreatments of difficult, screwed up treatments. Okay. And another brag is when you take out that last contamination, contrary to popular opinion, the deeper you go, the more sensitivity you'll have. You actually have less sensitivity, and you end up doing 90% fewer root canals. And so we avoid doing root canals by taking the bacteria out of the inside of the tooth. And by the way, the inside of the tooth that I talked about this earlier, the enamel is the castle walls, and it's all granite, and it's strong, and it can last a lifetime. The inside of the tooth is like a sponge that communicates directly with the blood vascular system. So when you get bacteria inside the tooth, it's a bacterial insult the rest of your life. If you take it all out and get a clean, uncontaminated interface, 50 years later, that interface is stable. If you don't, that interface is contaminated from day one. And in my opinion, that dentistry is a failure on day one. And so because of insurance reimbursements, it puts dentists in the position of working for a billing code, insurance, government-based reimbursement, and they can choose to do what they get paid for and take care of their family, or they can choose to do what's in the best interest of their patients and suffer because now they don't appear to be competitive with dental service organizations or offices that accept insurance in full. And so it's really degraded the quality of dentistry over my 55 years of practice. And I can't blame dentistry. They're being taught something that's a flaw, and they're not using high magnification, and they're not using digital photography and digital display, which is a form of magnification, to communicate with patients. And so so now
No, patients sometimes want to get away cheap because dentistry can be expensive, and they'll think, well, let's go the easy route. Let's go a route that my insurance covers. But in the end, they're going to wind up suffering and paying more in the future with all the extra work that's going to have to be done. Prevention is everything, and if you don't treat something in a safe and effective way to begin with, later on you pay a much bigger price. And you may not even have
and it's
dental insurance.
Yeah, and it's a cascading effect. And even patients that don't have insurance, the office runs on the insurance reimbursements. You can't charge somebody that doesn't have insurance more; they'll leave the practice. So it's a catch-22. And as I said, if you do something that is not foundationally stable, foundationally leads to predictability and longevity, it's a false sense of economy because it comes back, and it's like a savings account. It just comes back much more expensive. So it's doing the right thing conceptually, scientifically, technically will cost more, but over the long run prevents disease and saves saves a small fortune.
Without a doubt. Um, What kind of well, I happen not to be a fan of root canal at all. I believe that if I from everything that you were saying, everything that I have heard about root canals in functional medicine is they're terrible. So I'd rather have the tooth pulled and an implant put in. How do you feel about implants?
Well, I've practiced with two triple degreed implant specialists for over 40 years. Same office, my office. And if you've had the tooth taken out or the infection is too far advanced, but Howard, I told you that when you do the root canal well, under high magnification, under sterile conditions, with sterile filling material, it's like a bone magnet. When there is infection inside the tooth, the bone around the end of the root dissolves, and you get, and that's how we get x-rays that show infections. Well, when you do and I'm not talking about a tooth that's been abscessed for 10 years. That one needs to come out. It's past it. But on early uh, death of pulp, if you do this, the bone actually grows back around the root. It's biocompatible because it is no longer an infection. And you can actually see, we call a well done root canal on an early death. We call it a bone magnet because that shows biocompatibility. The periodontal ligament and the bone grow right back up to where, it was infected. And of all the root canals I've done, we get failures on some of them, but it's an extremely small percentage. And when we take them out, we can see what caused the failure. Generally, a cracked root, or it isn't bacterial demise, and we don't have any evidence that taking a tooth out improves the electrical activity, the meridians, and we sure don't have any evidence that putting in an implant, whether it's zirconia or whether it's titanium oxide, is any better. The analogy I use is if you had a fungus in your toenail, would you cut your foot off at the ankle? It's an amputation. And if we can avoid the amputation, the best way to do that is to prevent it from ever needing a root canal. And that's what I covered in session number 1 about prevention. But if you have a fungus, I don't want to have the first order of business be to cut your ankle off. And I want to preserve the teeth at all costs, infection-free, systemic influence, adverse influence free. And if I can do that, I get to eat my cake, and whatever the colloquial expression is, you get your cake and eat it too. And so I want long-term health and long-term function. And I think that's what being a holistic dentist, a functional dentist, a biologic dentist, all the monikers that people have to try to differentiate really come down to what's in the patient's best interest. And if you practice from what's in the patient's best interest, you will provide higher quality service. You will understand that the gut and periodontal disease are linked. It's taught that periodontal disease or gum disease or oral health is caused by bad bacteria attacking tissue. And as you stated with the probiotics, prebiotics axis, it's actually a war that's going on in your 100 square feet, the size of a tennis court surface area. 70% of your immune system is there. And if the same bugs are stuck to the teeth, it's your gum tissue attacking the bugs. So you clean up the gut or you clean off the tooth, gum disease resolves faster than I can get the camera out and take a picture of the redness, the swelling, the bleeding, which is what gum disease is. And that's leakage around the teeth. That's what I call gasket. The tissue around the teeth forms a gasket, a seal to keep the bad things out. And that shoreline all the way around the teeth can be like 26 inches. And most people miss 25 of those 40, 45, 46 inches of shoreline. And so if you want to prevent dental disease from shortening your life, you learn about how you keep the shoreline, that imaginary pencil line around every tooth on the tooth at the gum, how to keep that clean. And you take the internal decay and contamination that's under almost all fillings and inside of almost all root canals, and you eliminate that, and people live a longer, healthier life.
Well, thank you very much. This has been, a very important show. I don't know the listeners realize just exactly how important this show is. Your mouth is one of we're not separate body parts. We're all all our body parts are interconnected. And people don't realize how important the mouth is in terms of preventing and treating all sorts of diseases and problems in the human body, not just in the mouth itself. Doc, give us our contact information. Please say it slowly and say it twice. I'm sure people are going to have questions.
Okay, I'm going to give you the office cell phone text. So people can call and leave a message, or they can text. And the number is 949-899-5530. That's area code 949-899-5530.
Everybody, I want to thank you all for listening. Dr. Vigoren, thank you very much from Newport, the Restorative Dentistry. Brilliant doctor, practicing longer than me, 55 years as a dentist. I love it. Everybody, if you have any questions for me, you're welcome to call my office in Manhattan at 212-581-0101. That's 212-581-0101. I'd be happy to answer any of your questions, or you can actually reach me at Ozone Doctor, OZONEDOCTOR, at yahoo.com, ozonedoctor@yahoo.com. Please tell your friends about the show. Please subscribe. That seems to be a very important thing I'm supposed to tell everybody. So please subscribe to our show. Listen to all the shows. Tell your friends about it. Everybody stay safe, stay healthy, stay well, and we'll be back again soon with another segment of Functional Medicine with Dr. Robbins. Bye-bye now.